Welcome back to another episode of Preserve Health Talks. I'm your host, Dr. Ira Brustine, and with me today is our guest, Ann Cater, certified marital counselor and sex therapist from Chicago, Illinois. Welcome back, Ann.
Thank you,
For
Ira.
our second show in our series on sexual health. This episode is going to deal with sexual desire and frequency discrepancy. How often, how much? So is there really, Ann, such a thing as a normal amount of sex in a long-term relationship? Or are most couples quietly comparing themselves to unrealistic benchmarks?
Well, we do compare ourselves to everybody else, right? But to me, there's nothing normal. My sex is different from your sex, is different from my neighbor's sex. And it doesn't matter how much it is or what kind it is as long as it works for my partner and me.
So when couples argue about frequency, are they actually arguing about sex, or is there some underlying problem of unwanted feelings?
They're actually arguing about sex, Ira.
Okay.
Of course they are. I want more sex and you don't, and I'm mad and I'm frustrated and I'm not getting what I want. Now, the reasons for that discrepancy are multiple, and that you have to kind of dig deep and find out what's going on. If I'm angry at you and have simmering resentment, I'm not going to sleep with you. And all he can think about is I'm not getting laid enough. And all I can think about is he's such an asshole and he never helps me around the house.
So how do you come to resolution with that?
Just a lot of marriage counseling. You do, and you have your couples talk to each other. We do active listening skills because we really don't hear each other. So we start by having our couples face each other on a couch and tell each other how they're feeling, what they want, and have their partner repeat it back so they have some understanding of where they're at.
Well, couples that say, I'm too busy to have sex. I'm working all day at the office. She's working all day. We've got kids we have to take care of.
Yeah.
We've got household chores that we have to take care of. So let's plan a date night where we put sex on the calendar and we're going to have sex at this time on this day. Good idea, bad idea?
It's a fine idea. It doesn't always work, and sometimes people tell me it puts pressure on them. I find that what works best is if you can get out of the house, get a babysitter, sit across the table from each other, and I assign this to my couples to do. Sit across the table from each other, put your cell phones away, and talk to each other. That makes women and guys feel closer to each other. When we feel closer to each other, it's much more likely we're going to go home and feel comfortable enough to have sex. Because when we're angry and resentful, I'm not going to have sex with you. Not going to happen.
Well, in your many years of doing this, do you feel that the higher desired partner, the one who wants sex most frequently, is the male? Or is it ever the female?
Often. Oh, very often the female. That's really a myth that males have higher libidos than women. It just really depends. I've seen many women who would like to have sex once or twice a day and their partners are not willing or exhausted yeah. That's a myth.
Well, let's go with that thought for a second and talk about libido.
Okay.
Okay, everybody knows that libido is, your sex drive, for lack of a better definition. Is it always a biological issue, or is it sometimes just a barometer of relationship health?
Well, it's both, Ira. We have treated and seen many men in my practice who actually have very low testosterone, and many of them are treated then with injections of testosterone to bring their testosterone up. That's going to impact their libido. Libido, though, is, I think, mainly a psychological factor rather than biologic.
And I have found in my practice that very often men who come in and want their testosterone tested, and it is low or borderline low, that's not where you should stop looking. And if you have low testosterone, anybody in the audience is listening to this, you should also have your thyroid function checked. You should have your pituitary function checked. And you should also be tested for sleep apnea, because one of the biggest causes of low testosterone is sleep apnea.
Very interesting.
Yeah. So
I didn't know that. That's good.
And if you replace the testosterone before you address the sleep apnea, it makes the sleep apnea worse. So you always want to address the sleep apnea first.
So we should also talk about aging.
Let's do that.
Let's do that.
It's a good time.
So libido is very different, in the courtship phase of a relationship, the first 6 months, first year. I've been married a long time. You've been married a long time. What happens to our libido after 20, 30, 40 years of marriage? We may still have a normal libido, but it may not be so much directed at our partner. We may be tired of the same old, same old. That affects libido. We have to change things up. We have to keep things interesting. We have to work on it. We have to, find new places to have sex. We need to maybe watch some soft.
Well, let's talk about some
porn.
ideas of doing that in a long-term relationship.
Okay.
What are some of your suggestions?
So I think, some of my clients have enjoyed bringing erotica into the bedroom, reading softcore porn, short stories, watching something on TV, very softcore porn can be very titillating to them. Doing it in different places, I had a couple who did it in a museum while they were walking around. It was so fun for them. They had to change it up. You've got to do something different. You can't get in bed, you're tired, exhausted at midnight, and expect things to work well.
So then, should sex be spontaneous to be meaningful? As the museum, I'm sure they didn't go to a museum and say, let's plan on having sex in
They
the museum.
actually did. I
They
said,
did.
I gave them an assignment, and I said, you need to find, I don't care if it's a park, your car, you need to, and they happened to be, I think at a party in a museum, and they snuck around and did it quickly, and it recharged their relationship. It was so much fun. They thought, oh my God, who is this guy? It was great.
Okay. There are a lot of guards at museums.
Yeah.
It's hard to find a
But
private
not so
spot.
many guards when there's a private party going on. It was
yeah.
quite fun for them.
So should sex be spontaneous to be meaningful, or is it scheduled intimacy a mature solution that people unfairly resist? Because if this museum thing was planned, then that was scheduled intimacy in a strange place.
It was. So scheduled intimacy is fine, and sometimes we need to do it. We need to say, okay, we're going to set aside Wednesday night, we're going to put the kids to bed early, and we're going to cuddle on the couch, watch a movie, and then have sex. Sometimes that works, sometimes it doesn't. There's nothing wrong with scheduling intimacy. It doesn't always work. One of my couples, they text each other during the day. And if one is interested in being intimate that night, he may make reference to it or send a sexy text to her. And then she knows, okay, and they can start thinking about it, what they're going to do that night. So, and the arousal kind of starts during the day. And that's one way, again, to make it more interesting. Don't ignore your partner during the day. If you want to have sex with him or her at night, make sure you talk to them during the day. Make sure you listen and say how you doing and what's going on, and you look beautiful. That helps a lot.
Okay, one partner says, I don't think about sex that much. Is that a fixed trait? And if it is, can it be modified?
Well, it all depends. They may have low libido. They may not like their partner. There are a lot of, they may have medical issues, be on a lot of medications affect libido. It's complicated. It's both, it's psychobiological. It's both.
So, and we touched on this in our first episode a little bit, but I want to go back and bring it up again because it does deal with frequency discrepancy, resentment, resentment. The guy doesn't help out a lot at home. Or the woman shops all day and the guy's working. So resentment about chores, emotional labor, power imbalance in a relationship, finances. How often does that show up in the bedroom? And you're allowed to say always.
Always.
Always?
Of
Okay.
course. Absolutely. We're being honest. You know, everything that happens in the relationship shows up in the bedroom. And I'm sure you know that. If you have a fight with your wife and she's, pissed at you, it's in the bedroom.
So then the bulk of what you do with sex therapy is more couples counseling.
Absolutely. Sex therapy is kind of adjunctive, but it's all couples counseling. It's getting our couples to be more verbally intimate, to like each other better, to talk to each other more, to participate as a team with their children and with the house. It's important that we feel special to our partner, and that we have to do.
And we talked about how it's not realistic to expect levels to remain constant over decades of time. And it is.
No, it's not
No,
realistic. Absolutely
right.
not.
It's not realistic. But what I find particularly harmful to a relationship, and I tell patients this all the time, is when that marital or long-term relationship changes such that you're my spouse, you're my lover, and now one of those partners has become ill and the lover becomes a caregiver. It changes the dynamics in the relationship. And I have always felt as a physician that when a couple becomes a caregiver, it totally changes those dynamics and sexual frequency drops. So if it is all possible for that spouse not to be the sole caregiver for the patient or the other person in the sexual relationship, you can maintain some normalcy and still have a sex life. Have you seen that?
Nah.
Or
You know what? There's nothing sexy about being a caretaker, Ira.
right, but there's nothing sexy about being a patient either.
No. But I think sex is, if you're at the point where you need caretaking, I think sex is probably not on the menu.
But it may be.
But intimacy can be. Verbal intimacy, touching, closeness can develop. But, what we often see is, of course, resentment, because here I am now caretaking instead of, but, life throws us a lot of curveballs.
So libido comes and goes. Desire discrepancy waxes and wanes. So at what point does it become clinically significant and a problem where someone like me would refer a patient to someone like you rather than just a normal variation within a couple's existence?
If a patient complains to you that my wife won't talk to me and we're fighting all the time and we haven't had sex. I have couples I've seen, they haven't had sex for 7 or 8 or 10 years, Ira. And it doesn't even shock me anymore. There's so many, we call them sexually avoidant couples. It's shocking. But they don't often get referred. So you have to ask, how's your sex life? You have to ask if you're comfortable. Any sexual issues? Guys have so much shame talking about their performance problems. Even to you, they're gonna, I'm fine, doc. It works like I was 18. Not so. Women.
I haven't found that to be true. I find that most of my patients are very willing, if they're prompted with the right questions, to open up,
So
given enough time.
You are a very special doctor then, and you develop relationships, and probably that's the nature of your practice. You develop close relationships with your patients, and they are comfortable talking to you, which is really a gift because I'm not comfortable talking to my doctor. I see him once a year and it's boom, boom. It's 5 minutes. Certainly, he doesn't ask me how I am. He doesn't really care. But you have a unique relationship with your patients, which is very special. And it's the wonderful thing about concierge medicine. And that's why they're comfortable talking to you about it.
Well, thank you. What one thought would you leave our viewers with when it comes to addressing sexual desire? If couples are having this problem and you're watching this show, what should be their next step?
They should sit down with their spouse and first talk about it and maybe get some help, even in coming up with bullet points to talk about. And never start a sentence with you. You never have sex with me. You know, you. Say, I feel hurt or I feel lonely because we never, fool around anymore. We're not affectionate and I'm hurt by that. Never start a sentence with you and make I feel statements.
So in other words, justify your feelings.
Don't justify your feelings. All you have to do is say, I feel hurt. I feel lonely. I'm scared that we're going to separate. We don't have to justify our feelings. Our feelings don't require justification.
Okay.
They're our feelings. Right or wrong. They're not right or wrong. They're our feelings.
When I come back next week, we'll do a couple more episodes.
Well, maybe.
Yeah.
This is kind of fun.
Sounds great. It is kind of fun.
I like talking about
And we're
sex.
actually out of time for today. So thanks for joining us. We'll see you on our next show.
Time flies when you're having fun.
It does.